a lifeline in crisis. Understanding intubation and mechanical ventilation. In the high-stakes world of medicine, where seconds can mean the difference between life and death, intubation and mechanical ventilation stand as critical interventions. These procedures are often employed in emergency situations such as respiratory failure, cardiac arrest, and severe trauma, when a patient's ability to breathe is compromised. They are also routinely used during surgeries requiring general anesthesia to ensure an uninterrupted supply of oxygen. Imagine a patient arriving at the hospital, struggling to breathe after a severe asthma attack. Their lungs, constricted and inflamed, are unable to take in enough oxygen. This is where intubation and mechanical ventilation become essential, offering a lifeline to restore the body's vital oxygen supply. Intubation involves the insertion of a flexible tube, known as an endotracheal tube, into the patient's trachea or windpipe. This tube serves as a secure airway, bypassing any obstructions and allowing for direct access to the lungs. Once the endotracheal tube is in place, it is connected to a mechanical ventilator. This sophisticated machine takes over the work of breathing for the patient, delivering precisely controlled breaths of oxygen-rich air into the lungs. Securing the airway, the intubation process. Intubation is a delicate procedure performed by trained medical professionals, typically doctors, respiratory therapists, or paramedics. It begins with the administration of medications to sedate the patient and relieve any pain or anxiety. A device called a laryngoscope is then used to gently lift the tongue and epiglottis, providing a clear view of the vocal cords and the entrance to the trachea. With the airway visualized, the endotracheal tube is carefully guided through the vocal cords and into the trachea. The tube is equipped with a cuff that is inflated to create a seal, preventing air leakage and ensuring that the delivered breaths reach the lungs effectively. The correct placement of the tube is confirmed through various methods, including listening for breath sounds and using a device to measure carbon dioxide levels in the exhaled air. The endotracheal tube acts as a conduit, a secure pathway for oxygen to reach the lungs and for carbon dioxide to be expelled from the body. It bypasses any obstructions or swelling in the upper airway that may be hindering breathing. This is crucial in situations where the patient's airway is compromised, such as during a severe allergic reaction that causes the throat to swell shut, or in cases of facial trauma where the airway is obstructed. The breath of life mechanical ventilation and its modes. Once the endotracheal tube is securely in place, it is connected to a mechanical ventilator. This machine becomes the patient's temporary lungs, delivering a controlled mixture of air and oxygen, ensuring that the body receives an adequate supply to maintain vital functions. Mechanical ventilation isn't just about forcing air into the lungs. It's about providing the right amount of support, tailored to the patient's individual needs. This is where different ventilation modes come into play, each offering varying levels of assistance based on the patient's condition. One commonly used mode is assist control, AC, ventilation. In this mode, the ventilator delivers a set number of breaths per minute at a predetermined volume. If the patient initiates a breath on their own, the ventilator senses it and provides assistance, ensuring a full breath. This mode is often used for patients who are unable to breathe effectively on their own, such as those in a medically induced coma or suffering from severe respiratory failure. Another mode, Synchronized Intermittent Mandatory Ventilation, SIMV, allows for a more natural breathing pattern. The ventilator delivers a set number of breaths per minute, but the patient is free to breathe spontaneously between those breaths. This mode encourages the patient to gradually resume their own breathing efforts and is often used during the weaning process. For patients who need less breathing support, Continuous Positive Airway Pressure, CPAP, may be used. CPAP delivers a continuous flow of air pressure through a mask, keeping the airway open and improving gas exchange. This mode is often used for patients with sleep apnea, or those who are able to breathe on their own, but need help maintaining open airways.